All right, I would like to call to order the Human Services Committee meeting for May. First item would be the approval of minutes for the March 19th meeting. Do I have
I'll make a motion to approve the minutes.
do we have a
Second.
second? Second, all in favor?
Aye.
So we did not have an April meeting, so. Is there anyone here for privilege of the floor? Anyone here for privilege of the floor? Seeing none. One thing we do have to do a little cleanup is withdraw a resolution that was included in the pre-file but not on the agenda, and that was the appointment resolution to the Office of the Aging Advisory Council. So, I'd like to, do I have to have a motion to?
No, just announce it's withdrawn.
We are withdrawing that resolution, so. So the first item up for discussion is the local law intro 2-25, a local law regulating the use of public and private sewers and drains in sewer districts established by the County of Chautauqua.
Pierre Chagnon, Chairman of the Legislature. As much as I'd like to read these 64 pages to the committee, I'm going to pass on that tonight.
Thank you.
So let me just give you a brief description. This local law describing this sewer use ordinance is general purpose is to provide for efficient, economic, and environmentally safe and legal operations of the publicly owned treatment works established, existing, and used by sewer districts of the County of Chautauqua. So this sewer use ordinance was first constructed and adopted in 1979. It was modified a couple of times, and it was last updated in 1994. So this is an update that is been a long time coming. This came to a head when the city of Dunkirk, which treats the waste from the industrial sewer district, the county industrial sewer district, was audited by EPA, and they looked at the county sewer use ordinance and said, that's way out of date. You've got specifications and standards that are cited that are way out of date. So the county needs to update the sewer use ordinance. So that was 3 years ago. We've been working on this for 3 years to get us to this point. And I think we've finally got a document that everybody is comfortable with. This has been reviewed and accepted by the directors of all the county sewer districts. It's been reviewed and accepted by the city of Dunkirk because they treat the waste from the industrial sewer district, and by the village of Fredonia wastewater treatment plant, which treats the sewage from the Portland, Pomfret, Dunkirk sewer district. So everybody has reviewed it, everybody's on board with it, and so now we'd like to adopt the local law, and that will be on the agenda for next Wednesday night.
Okay.
Any questions? I'd be happy to answer.
Is there any major changes? Or just-
Major changes, but the changes are updates, really. Probably the most significant change is that if a property owner has an illegal connection to the sewer, in other words, they've connected their sump pump, their floor drains, their downspouts to the sewer, there's no way for the county to investigate and enforce the violation of the local law. So what this new local law does is we incorporate a requirement for an investigation anytime a property is sold. So that gives the county an opportunity to investigate on the sale of a property. And so if there's any violation, just like an inspection of a septic system, inspection of a well, if there's any violation, the prior owner has responsibility.
Seller.
Yep, the seller.
And I'm sure there's some of them out there.
There's a lot of them out there, and it's been very frustrating that we've been unable to really address these. So this has been something we've been pursuing for decades to come up with a way to do this.
Are we gonna go through all 64 pages Wednesday night?
Oh, sure.
We are?
No, no.
I'm on vacation.
Okay,
Gee.
any other questions, concerns, comments?
So, I did read through this brief, I read through it. There's a lot of different contaminants that can enter into the sewer system since '95. Was there a particular section in here for, the little plastic things,
PNFAs.
yes,
Yeah.
PFAS?
No, those regulations are still being developed at
Okay.
the state level
Okay.
and the federal level, so those regulations have not come forth yet.
Because that could have a major implication on this policy, and I know that those things are coming and
Yes.
they have their own ramifications. So I would, I didn't see anything in here when I read through it. I kinda assumed that it just wasn't ready yet, but 3 years is a long time to be getting this, so it's good to get it approved. We can always amend it next year or the year after if we need to, which we probably will, but.
So long as I'm on this legislature, I can assure you, this will not go 29 years before it's revised again.
That was it. Thank you.
Thank you. Okay, proposed resolution. Authorize renewal of lease agreement with Jamestown's Rental Properties LLC for office space at 333 East Fifth Street in Jamestown, New York.
Evening.
Good evening.
Josh Rothwell, Assistant Deputy Director, Public Facilities, Buildings and Grounds. This resolution is to just extend the agreement that we currently have at 333 East Fifth Street in Jamestown with JRP Properties. Currently, we occupy that space with Mental Health Department. This is just going 2 years on the same terms, same conditions, same utilities, being paid for by the building owner. And it also is staying right in line with the 4% per year increase in cost. Typically, we strive for a little bit longer of a lease agreement, but we did this one at 2 years because we're just really not sure where we're gonna end up in the long run, as far as what's beneficial for the county in 2 years. And that puts us in line with all of the other lease agreements in the South County ending within approximately a 6-month period. So hence the 2-year agreement.
Is this one of Jody Peterson's properties?
Correct, yeah, JRP.
Were we having problems with this as far as getting things fixed? and-
This, not in this building.
Not in this building,
This building's actually really good. Very well
There was,
kept. Other facilities, yeah, there's been issues in the past, that have been.
With
getting better.
JRP,
Correct,
okay.
yes.
I was hoping I wasn't thinking wrong.
No, that's correct. Things have gotten quite a bit better recently in the last year and a half. And, again, when my director and I sat down and negotiated this here, we, also made it known that, those issues in the past are starting to get better. And we hope that that continues to trend that way. And kind of a 2-year, let's continue in this direction and see where we're at then, and hope things don't go back the other way. But this building, out of any of them that we rent, has been fairly well maintained.
Okay. Any questions? Comments? All in favor?
Aye.
Okay.
Mr. Chairman, if I may, I would suggest, if I could, that you take resolution number 4 next, because Mr. Rothwell is actually here to speak to that one as well on behalf
Oh,
of
sure,
mental hygiene.
absolutely.
Just to make it easier.
I didn't get the agenda.
help your knees out a little bit. So we'll skip to number 4. Authorize extension of lease agreement with Town of Chautauqua for office space for Chautauqua County Department of Mental Hygiene.
This resolution is to extend the current agreement that, they have at 2 Academy Street Mental Health again. This agreement actually expired on 3/30/25, and they're just asking for an extension of the current agreement as written. For whatever reason, 10 years ago, when they did the leases up there, this was 2 separate agreements, and it was, from what I understand, because it was paid for out of some different grants, like, the specific grant at the time had to have its own agreement. Well, that's not the situation anymore, and the other current agreement that they have at the same location on the same floor, expires at the end of July, so that agreement will be turned into one agreement. So this is just lengthening this to the end of July.
Okay.
To additionally combine the 2 into one for a longer term agreement.
So essentially a 2-month, well, I guess a 4-month extension. If you go back to March,
Correct.
so.
But again, same with this agreement, all the terms stayed the same, the utilities and everything
Does this have a escalator, 4%? Or?
No, this one, it's paying the same amount since 3/30/25 when the current one expired until this, proposed resolution, if passed, goes through, it'll stay the same amount.
Okay.
And then we've already met, mental health staff and I have met with, Don Emhart, town supervisor, and negotiated those terms, and the town is still good right where everything sits up
So
there.
we're gonna combine into one agreement?
Yep, it'll just be one.
Basically be the same
Yes.
going forward, okay. Any questions?
I should add too, that has to be what Don, myself, and leadership at Mental Health discussed, still needs to be approved by the town board as well. So, but yeah.
Any questions? Okay, all in favor?
Aye.
Thanks, John.
Thank you, guys.
Okay, back to number 3. Authorize acceptance of Health Equity Innovation Grant from Univera Healthcare for Local Roots Program. And I am,
Hello.
hello.
Steve Dando, Grant Coordinator for Office for Aging Services.
Diana Songer, Deputy Director of Finance for Human Services.
And we're here to present the proposed resolution to authorize the acceptance of Health Equity Innovation Grant from Univera Healthcare for our Local Roots program. Univera Healthcare has approved 13 organizations within the local area, us being one of them, for these awards. The amount of our award would be $15,000. And those would offset the expenses for our Local Roots program, which is designed to provide access to healthy produce and monitor participants' blood pressure, body mass index, with an overall goal of reducing those health outcome measures. It is estimated that we provide these services to approximately 450 to 500 local residents on an annual basis.
Any questions? Comments? Okay, all in favor?
Aye.
Aye.
Thank you.
Thank you very much. All right, next up is a discussion. It's an overview of the Department of Mental Hygiene, focusing on Chautauqua Tapestry's work as the county systems of care. May is Mental Health Awareness Month, and I think this is a very appropriate discussion to have. And there's, from what I understand, some exciting news.
Hello,
Hi.
happy May Mental Health Awareness Month. I'm
Yes,
Rachel
absolutely.
Ludwig with the, yes, thank you for these, these are very great to have. Rachel Ludwig with the Department of Mental Hygiene, and Deb is playing Vanna White with some visual aids, so you can have the the side-by-side with some color. We decided that Deb could have a children's book. It's so beautiful. But we wanted to give you just a brief look at what the Department of Mental Hygiene is. Since it is Mental Health Awareness Month, I wanted to get some statistics out there. So Mental Health Awareness Month has been celebrated since 1949, and it's really a month that we look at increasing awareness and really decreasing concerns to accessing care. So on May 8th, the county executive officially declared it Children's Mental Health Awareness Day. So that's one special feature of the month, but the whole month there are weeks that highlight different avenues of awareness. So we're happy to be here to talk a little bit about the children's side of it, but also to introduce the department. And special thanks to Deb and Julie, is it disconnected?
Yeah.
For putting the presentation together. And we'll show you on here, and you may have probably seen it several times, but our logo represents a lotus, and the lotus represents growth and resilience. And you can see the colors there also kind of pick up that mental health green and the blue kind of healing with the hands. Yep.
Got it.
Exactly.
Thank you.
So the term mental hygiene is kind of awkward sometimes. I think hygiene people think of as cleaning your teeth or kind of keeping clean. And that is kind of how we think of mental hygiene as well. It's really preparing, preventing, taking care of, just like you do for physical health, more of a mental health feature. So improving mental health, preventing illnesses, and that sort of thing. And in order to do that, we have lots of different types of services. So you'll see some of the services listed here with some clinics, so behavioral health clinics. There are care coordination services, forensic services, which means services in the jail, and also some outreach in the community with crisis work. And the mobile services, you can see we don't actually have a mobile crisis van, but we do have mobile crisis teams. 24-hour coverage is a requirement from the state, so we have contract in place for the nighttime, and we have a full-time team to handle mobile crisis services. So we also put together a video, which we'll give you a link to, but it's really to highlight the different facets of what the local governmental unit is, because it's kind of abstract when we talk about what mental hygiene does. We do have services, but it's much more than that. We have also this role as the local governmental unit. So an explanation of that is scripted, and it's online. We'll send, like I said, we'll send the link out of that. But it does show that we have connections, and there's not oversight of all these areas. It's really just showing the connections. And it probably is tiny print, right, hard to see. But we have things like, there'll be a connection to some housing services or supportive providers and in-housing centers. So it's not that we have housing that we offer, but it's really connecting to those housing providers. For example, we have a contract with Eagle's Nest with Rome to provide some respite services there. And then some of the license programs, there is some oversight with the license OASIS and OMH programs. And then the connections to the state facilities where we referred to them and they referred to us. Certainly connections with local providers. There's one hospital, as we know, the Article 28 hospital, UPMC, so that's one that we have a formal connection with. Social services, as you know, we're an integrated department, so lots of overlap and lots of support there. The legal system is another one that we have connections with, some very direct and some indirect. Services in the jail we have mentioned. And we have on the bottom, I don't know if you can see it, but there's a little heart on the bottom, and that's the citizen. So our main purpose of sharing this tree is to show if there's something that doesn't, if there's services on there that aren't connected, we want to be connected. We always have room to grow. We always have opportunities to do a better job and make more connections. But we do keep pretty busy with these dots, and the main purpose is for the citizens of Chautauqua County. All the work is really to support how we support the people who live and work in our county. So Trish asked me to do just a little presentation about Tapestry, and that to me fits really nicely in with the local governmental unit, but on the kids' side. It's sort of that overall focus, a system of care as a way of blending together the supports and services. So it's, again, not direct oversight, it's not direct support on all of the features, but it's really trying to connect the dots for folks.
Is this a newer program? or
So
new?
this one specifically, the birth to 21-year-old focus, this is year 2 of 4-year grant. Yep. But it's a great question because we have had 4 different grants and each one is a little different in who they serve and the focuses. And the focuses really come from the federal government. They put out requests for proposals. So the response sometimes does meet a lot of what they're looking for. But if you look at who we serve, if you think about, well, how do you work with infants when you're talking about mental health? And that's where the prevention piece comes in. I think that it's looking at preventing mental illness, but you do that with dyadic therapy, behavior shaping, environmental response. And there are people in our community that provide those services. So sometimes it's just exposing people who need to know about the services. Sometimes it's a school or an early care center to know which services are out there and would be available, and making some new partnerships. And with that in mind, looking at who provides the different services, we're not looking to take business away from anyone. Rather, it's really increasing the work that good people are doing good work in this community, so it's really to support them in doing that through coordination. We do try to offer some trainings. Each grant has had a focus of kind of trying to raise the bar of services across the board, really educating across the board about care and support. So we have these community events, a lot of public awareness events. Again, it's about decreasing stigma, so there's awareness campaigns, tools and support. We get a lot of resources right from the federal government, so we try to share those. And providing services, yeah, and the services, so for each grant there are specific services. For this grant specifically, it's family peer support expansion, youth peer support expansion, and the PACS Good Behavior game, so that's a school-based prevention intervention. Those are some of the main ones. And where are we? One of the pieces that we thought would be interesting is to try to look at a map of the districts where, over the different grants, we've had a couple different ways of interacting with programs. So the dots don't represent specifically a person being there necessarily. In some cases it's a therapist that's on site, and in other cases it might be a training program that we conducted. But the first grant was a 6-year grant, so we had a number of different schools that we interacted with in different ways. A lot of them in that grant were really looking at trainings. We had a lot of training around high fidelity wraparound, and a lot of the school districts were very involved in those. And we also did some program expansion with the Parents as Teachers program. And then the next grant, we added some different programs, and again, it's a little different each time. Some of them we had this was a school age feature, so it was looking at 4 to 18 was the age groups for this. So really tried to make some targeted outreach with some of the other school districts and engage the ones that we had connected with in addition. And then the third grant, we piggybacked and went from the school age to the preschool and older adolescents with colleges, but we maintained the school partnerships as well. So it's kind of a fun way to see that we're trying to stay connected. It's not about always being directly involved in providing direct services, but try to stay connected in some way, whether it's having a therapist in the school or doing a training. I know we have someone who does the keynote every year at the Sherman School, and you know, that's led to them wanting a therapist in the school. So sometimes they build gradually over time. And then this last grant, we have some more specific ones, really looking at some of the school-based programming. For example, with the PACS programming is in a couple of the specific schools, but then we also have additional therapists, and now we have therapists in 7 school sites. So that's a huge way of expanding the services and outreach. And it's not grant-based, it's also department-based, it's also other providers as well. The Resource Center has specific school-based services as well. Prevention Works has a ton of school-based services. We have also the Chautauqua Health Network has school-based services. So it's not done in isolation, it's really trying to keep track of the programming throughout the area. But we wanted to show you that when you're thinking about what does exist, there really are a lot of services countywide, and sometimes they look different depending on what the appetite is in that community. But it's fun to see the growth, I think, over the years. Yep. And there is a video, and it's, how many minutes is it?
2.
2 minutes. So just a quick video, if that's okay? Okay.
My name is Josh Gazelle. I'm superintendent of Chautauqua Central School District. I'm also the president of the Far West Council of School Superintendents. So we have been involved with Chautauqua Tapestry for 15 years. We've been blessed to always have a school-based social worker on our campus. We've done an amazing job working with our students and their families. This need has increased, as many of us know, since the pandemic. And it's been just something that has been a blessing for us.
My name is Anna Darzinski. I'm a mental health therapist, and I am based at Chautauqua Lake School and some of the campus. With Chautauqua Lake and Chautauqua Tapestry's efforts, I'm involved by providing evidence-based quality mental health treatment here to the students, K through 12, and their families for that matter. It can be greatly beneficial to have therapy services here outside of the school. You kind of provide that nice little short respite time during the day to de-stress, process what they're going through that day, maybe help them plan and organize going forward, organize our days better, but I think it really does provide that nice respite time for the students.
Hi, my name is Megan Henry. I'm from Hillside. I'm a program manager for family and peer support services. We do offer family peer support services right now, and with a new contract, we'll be adding new peer support services. I hope that we continue to grow. It's been great to partner with Chautauqua County, Chautauqua Tapestry, and we do have 2 family care advocates right now, and with this new funding, we'll be adding another family care advocate and adding a youth care, Christina Green, social and emotional learning specialist and training specialist. Chautauqua Tapestry has made sources of strength possible by investing into this program, investing into the trainers within the department to make sure that we are operating under fidelity and making sure that each school district has the opportunity to tap into this service and this program, and always including it as a top deliverable with lots of things that we work for.
Good morning.
And our big question is, how can we help you? Are there messages that you could think of that you'd like to hear more about? Are there folks that we need to hear from? Are there community members who are in need of either a presentation or just to be able to be heard? Sometimes, you might hear that someone saying there's no services, and we like to have dialogue when we can. We don't have all the services, we don't have all the answers, but certainly we like to be engaged and involved if we can. So we're open to hearing about, in general, not necessarily today, but what we can do to help.
I think a lot of it is how we can help you. I don't, we need to know what you need and how we can help too, because, I mean, I think you're doing a great job, especially getting into the schools with the younger kids.
I think, the health department as well, I see Steve back here nodding too. I think the reception has been really great, and part of that is just having the opportunity to connect and be heard, so.
Yeah. Hannah indicated that her services go to the students, but also the family as well, so.
Yep.
It's a way to connect outside of the school.
Yes, so we have some of the clinicians that see students in schools. We'll see them at the clinic for their family therapy. Sometimes they'll do telehealth and bring the families in either by computer screen or by phone. And we also have some families or some therapists that work later in the school. So we have one therapist that does 4-hour days or 4 days a week because she does long days, so she can see families after school.
That's fantastic, I think. Anything else?
And I guess one other thing is how you can help us and we can help you is just if questions come up and resources are needed. We hear about it a lot, but probably not enough. So please let us know.
Yeah, absolutely.
Thank you.
Thank you.
Thank you very much. Okay, our next is a presentation from Health and Human Services Division of Temporary Assistance Report.
What was that look?
Oh, jeez, sorry. Diane Anderson, the Director of Temporary Assistance.
John Anderson, Deputy Commissioner, Social Services.
So I'm reporting on the month of January. All the information in this report is for January. In the month of January, the New York State participation rate was 13.9, rest of state was 13.5, and Chautauqua was 11.2. So we rank 30 out of 57 counties, or 27th in the state for the highest rate. In January, there were 63 individuals who are participating and counting in the all families participation rate. And the total number of recipients who were engaged was 200 families, so that number includes those that counted. So there were 137 families who were participating in activities, but just not enough to count in the rate. If we only looked at those that were in the non-exempt category, the participation rate would be 15%. In January, there were a total of 19 conciliation notices sent to those who were not participating in work activities up to the maximum number of hours required. And 38 sanctions were processed for failure to comply with employment activities. 5 in the all families category, 2 safety net, and an additional 31 for non-compliance with substance abuse. A total of 37 individuals were in sanction status as of January, and 31 of those were sanctioned beyond the duration, so they could have done something to end that, but have chosen not to. And 25 of those sanction cases were used in the denominator to figure the rate. So nothing we can do with them, but they do count against us. For the non-exempt and exempt population, the exempt individuals again exceeded the number of non-exempt, so 993 exempt versus 799 non-exempt. And of the 799 non-exempt, 411 were in the all families category. 63 of those were participating and positively counting, and 137 were participating but not enough to count. Of the 993 individuals who are exempt, 285 were in the all families category. The IMA report for January, there were 167 individuals referred for assessment. 95 of the individuals showed for their assessment, resulting in a 43.1% no-show rate. And of the 95 individuals who were assessed, 2 failed to comply with the interview, 36 did not meet criteria for treatment, 17 were already engaged in treatment and now monitored by IMA, and 40 will be referred to treatment and monitored by IMA. Of the 57 new IMA clients, 5 are in short-term rehabilitation, 7 are in long-term rehabilitation, and 45 will be receiving outpatient treatment. In the month of January, 94% of the cases referred were in the safety net category, and 6% were in the family category. At the beginning of January, IMA was monitoring 126 cases, and at the end of the month, 16 individuals had completed treatment and/or monitoring, and 42 were closed for noncompliance. 15 individuals were determined to be employable, which is a rate of 11.5 for January. The number of days to employability was 125. The temporary assistance caseload appears to be stabilizing. There was a slight increase in February, which doesn't show on this report, and then it went down again in April March and April, so where we stand in April is 2,076 cases, so it's just slightly above what it is on this chart in January. And if anyone looked at the one I emailed this last week, I did have to make a correction to both the temporary assistance numbers and the SNAP numbers. We had the same ones for last month. I should have known that wasn't right, but, so those are corrected. The SNAP caseload did increase by 139 in January, but still right around 11,000 where it's been for quite a while. In January, the number of applications increased by 284. I did change this a little bit to include some of the information, breaking out homeless emergencies besides the regular emergencies for other items. So that's why there's no number there for December, but there is one in there for January. And we denied 33% of the applications for failure to follow through with the application process. For temporary housing in the month of January, there were 290 cases in temporary housing, and of the 290, 119 were single males, 92 were single females, 8 were couples, and 71 were families. There were 2 individuals on parole or recently released from jail, and 28 individuals placed in temporary housing due to Code Blue conditions in January. The cost of temporary housing for the month of January was $551,253.76.
Question with
Sure.
that, do you see, do we have any new places opening up for, some temporary housing, or what's the forecast for those places opening soon?
We don't have, we have the women's shelter that did open. I don't know if I said that last time I was here. So they are transitioning some people from hotels to the shelter. They're still in process with that.
Do you see this having a little potential savings there?
It probably
forward?
won't save money, cause I think it's more expensive, but they will get more supports
Okay.
from, they'll have on-site case management, people that will be helping them along the way to get them housed.
Okay.
We do have a couple of new programs that I've added in here on page 6. The first one is the Public Assistance Shelter Supplement. So we applied for the shelter supplement plan back in June of 2023. I think I mentioned this last time, and we hadn't heard anything. So we did get approved for that in March 25th of 2025. The plans allow for an additional allowance for up to 50 families and 125 single individuals or childless couples. The additional allowance, when combined with the shelter allowance, which the shelter allowance is set by OTDA, it will allow them to afford an apartment up to 85% of Chautauqua County's fair market rent. So I put a couple of examples below in a little chart. Shows a single individual, 167 is the amount that OTDA sets for the shelter allowance, and then the shelter supplement for a 1-bedroom would be $449. So a total of $616 could be sent directly to the landlord, which gets them closer, not up to the fair market rent, but closer to where they need to be able to actually get out of temporary housing and get into an apartment.
It's important to note as well that that $616 that's can be sent directly to the landlord is significantly less than what temporary shelter costs for the month.
Sure.
So that's the potential for cost savings that you were bringing up, and that is why we applied for it. It took quite a while for it to be approved, but now it has been, and I think, what was it, about 6 weeks ago, Diane, they started the process?
Yeah.
And it's benefited some folks already. We'll have more data on that as the months go by.
I have a little bit
oh,
of
okay.
data for that, so.
How long is that grant for?
It's permanent, it's forever until, unless the state says no more, but it doesn't seem as if they would do that. It saves the state funding as well.
And
Right.
this,
It is something you have to apply for. They don't grant it just automatically. They ought to really adjust this at the state level though, so that every county can benefit the same way we are.
So the OTDA assistance is the one that hasn't changed forever.
Right,
That's
It's-
correct.
yeah.
So they could do that too, but they don't.
What is the gap? I mean, you know, you
Between
say
the
you're
two?
closing the gap, yeah, so, I mean, are we, you know, how short are they to being able to, what an
Oh.
average apartment would be?
Fair-
Yeah,
fair
fair,
market.
It's, I don't know if I brought that one with me. Oh yeah, I think I do have it. Hold on.
you know, just curious how short they are, you know?
It's not hundreds
So,
of dollars, but
For a one bedroom, a single person would, it'd be $725.
Okay, so there's, I mean, it's.
close.
You're getting close, and that's,
Right.
that's what will help with those,
Yeah.
with those numbers. And in that sense, it helps the people, you know, it's gonna
Right.
get them into a place where they can have some security too, which is great, you know?
I think also it's already helped people be diverted from emergency shelters. So if somebody's being evicted because of failure to pay, we've been able to help with that as well in cases. And I think Diane maybe
Yeah.
has some information about that.
Yeah, I do. So, when the program is full, the 50 families and the 125, single people, we anticipate a $4.4 million savings. And 2.8 of that is local share savings, so,
Contingent on availability of properties in this price range.
right.
Sure.
Yes.
Yeah.
What's the availability? I mean, is
It's
that?
hard to say at this point. I know, and there probably is data on that at the city level, and maybe even at the county level. I'm not sure if one of our other departments has that data, but we can ask for that
Yeah.
to see whether or not there's housing data available on the availability of low-income housing. But there's definitely a need for more. I think that's been documented in studies that have been done by I can't think of the name of the group, the county group, but it has been documented, there's a need for more low-income housing,
Yeah.
which would benefit everybody that's in temporary shelter.
So far, we've enrolled 33 households into the program, 22 single individuals or couples without children, and 11 families. So some of those numbers we diverted because they had an eviction, so they didn't end up going into temporary housing. And some of them, we moved from temporary housing into an apartment.
So you wouldn't necessarily see cost savings on each side, you'd see basically a reduction in expense that we would never realize, yeah.
Are there requirements for them to continue to keep this?
They have to maintain eligibility for temporary assistance, so they're eligible for the grant as long as they maintain their eligibility for the program for temporary assistance overall, for their benefit. So if they become employed or for some reason something else happens, then no, they wouldn't be eligible any longer, but it's permanent, so it's as long as they stay a temporary assistance recipient.
Yeah. And then the other initiative that we have is the family-centered case management. In July of 2024, we were allocated funds to hire case management staff for families who are having difficulty stabilizing their households. And then in collaboration with our mental hygiene partners, we have an integrated team of case managers and senior caseworkers formed to initially work with families in temporary housing. As the temporary housing numbers go down, we hope to work with those that are having issues with stability that may become homeless, so we aren't there yet. Currently, they have 55 families that in temporary housing that they're working with. Katie wasn't able to be here tonight, but I did include at the back of your packet, not the one that's not stapled, the two brochures that I mentioned last time that we worked on collaboratively. One is for employers, so it just tells them about the work experience program, and it has some testimonials from participants who have been through the program and what they got out of it. And then this other one is, it'll look like this instead of what it looks like in your packet. But this one is for participants, so it tells them a little bit about the benefits of the program. And on the back is frequently asked questions for participants. So that we're excited about those, and we'll get those out to people.
How do you distribute that?
they hand them out to employers, the WIB does, because they work with a lot of the employers, but they're hoping to generate some interest in accepting work experience participants. And then the other ones we can hand out to our clients. Are there other questions?
Yeah, I got, page 3, when you said 42 closed for non-compliance. What does that mean, and what happens to them?
Yeah, so they don't, if they didn't go to, their treatment program as assigned, then what we would do is send them a conciliation notice, and if they don't respond to the conciliation notice or, don't subsequently comply, then they would get sanctioned. So part
They
of
get
their.
what?
They get sanctioned, so, it could mean that they lose all temporary assistance for single people. If it's a family though, there would be a reduction in the amount of their grant.
On singles, does that happen quite a bit, that they don't come
Yeah,
back?
I don't have the number, but, yeah, it does. Any other questions?
On that same page, you said 11.5% were determined to be employable.
Mm-hmm.
Seems kind of low. Is
Yeah,
that
it
something-
shifts every month, so
Yeah.
I think it kinda depends on who they're working with at the time.
Okay. Anything else?
Just a big picture. Where do you see us heading? You know, we saw it, just on kind of these basic numbers where it ends in January, we're seeing it starting to rise up again a little bit.
With the case numbers, I think what we want to see is a trend, and I don't know that we have enough data yet month to month to demonstrate a trend. I think Diane mentioned that maybe we see a little stabilization,
Okay.
but we only have the past 2 or 3 months where that's stabilized within a certain, we don't see any spikes in any direction. So we'd want to see a little bit more of that.
We
And
have
I
a-
can't predict it, but we'd want to see that in data.
We have, budget meetings coming up, and
Right.
I'm sure right now is when you're preparing those budget numbers, so it's important to be able to be as accurate as possible, and, I know it's always a
With the
challenging
projecting, yes.
area, and, it's difficult, so, we know that you're putting all the best efforts forward to try to have accurate numbers, but, yeah. Okay.
Yes, sir, thank you. Any other questions? No? Okay.
Thank you.
Thank you very much, as
Thank you.
always. Good work. Do we have any other business to discuss? Okay, do we have a motion to adjourn?
So moved.
Second?
Second.
All in favor?
Aye.
We are adjourned. Thank you. You need to sign that one. Thank you.
They're stealing.